Hi, this video is the hair transplant on a client by the name of Roman Moreno. Say hi, Roman.
Hello?
So Roman and I will have a project, and he's gonna take photos every day, and then in the end of the year we're gonna combine together and see how his transformation is. He's on a mission, actually gonna transform his whole body. It's not just the hair, but once he has the hair and with the motivation, he's gonna start to exercise, weight loss, build his muscle, and get back the man that he used to be. And so he was telling me about, getting married. Married was a good thing for him, but sometimes when we get married, we're so comfortable and we just let ourselves go. But he want to get it back, and we're gonna do a project. And so we will do this video on today, the day his surgery. It's October 30th, the day before Halloween. And we're gonna do another follow-up sometime either 4 or 6 months later, and then we're gonna do in 8 months, and then we do 10 months and a year. And I'm gonna show the audience what his transformation is. I'm very excited, and I'm glad he's doing this because now, with every patient, I'm gonna do my best to give them the best result. But by allowing me to film the whole thing, that means putting a lot of pressure on me to give the best product, to create the best hairline for him. As he mentioned, he's my canvas, and I'm glad we are starting today around we're going to do at least 4,500 grafts. And so as you can see, look down for me, all the way down. That's where his hair loss is. And you look straight up at me. There we go. And good, perfect. Now we're going to focus on and turn to the left. And we're going to bring his temple. As you can see, his temple has his hairline not gone up also, but the temple have gone backward. So he's gonna turn the other side, and we're gonna bring in the temple on both sides. Okay, perfect. Okay, now look straight at me. So hair transplant, again, is an art form. It requires a lot of the artistic and aesthetic detail to ensure very natural results. So if you can see, take a look right there, perfect. You can hold that, and I'm going to explain to the audience what we're going to looking for. So from the mid eyebrow to the hairline, on average for Asian and Black, it's around 6.5 to 7 centimeter. For Caucasian, it's around 7.5 to 8.5 centimeter. Hispanic, it can vary as low as 6.5 all the way as 8.5. But actually, this client came up to 7 centimeters to be exact. And we base on his anatomical landmark. So when he frowned, perfect. See, he followed my works for years. On the high crease, that's where his hairline should be. So when he go ahead, relax. And then from the midpoint toward the temple, on average, is around 7 to 8.5 centimeter. For actually where he is now, from the midpoint to the temple, it's like 10 centimeters. So that's giving him a really wide forehead. If we just lower the hairline without bringing the temple, he's gonna have a really wide forehead, and he has hair, but it doesn't look natural. So we did the measurement, and based on his anatomical temporal muscle, it actually come up to be 8 centimeters. So we do a measurement from here to here, 8 centimeters from the middle to the temple is 8 centimeters, as you can see. And when you bring the temple, it frames the face better, and from here to here. And so from the mid eyebrow to the hairline is 7 centimeters. From the midpoint to the temple is 8 centimeters. So it's perfect for his face. And now once we get the shape down, we transplant zigzag, no hairline straight. We have two type of hairline called the tight hairline and then the soft hairline. The soft hairline has bigger zigzag. It looks soft, but then it looks because we use more baby hair. But the downside is it looks less dense, even though the number of grafts is the same. The tighter hairline is smaller zigzag, and quite a bit of people in the public eye or celebrity, they want to bring a wow factor and give a very sharp look. Then the tight hairline is the way. But on average, most people prefer somewhere in the middle because they don't want too soft and too tight. And so you can have the choice of the third one, which is within between. Once we get the shape down, we would transplant at a very precise angle at 35, 45 in the front. Change it when you go up, and change it when you go sideways. The temple is flat and go sideways as well. So the precise angle is very important. Selection of hair grafts is important. We try and plant rows and rows of single hair graft in the front, followed by root to go 2 hair, 3 hair, and 4 hair in the back for bulk and volume. And then, not only that, when we make the site, we're gonna make sure, measure the precise diameter of each hair follicle. The root to go 1 hair, root to go 2, root to go 3 and 4 have different size. And why we do that? Because we don't want to make such a small hole and try and squeeze a large hair follicle and you kill the graft. Or likewise, you make a big size hole and you put a tiny hair follicle in and it fall off. We want to make it fit snuggle, no struggle and no trauma, and then high chance of growth. I'm very excited for my friend here because in a year time he's gonna be a big transformation. And so Romans, before we go in, we gonna talk about at least 4,500 grafts. If I can get to 5,000, that's fine. But we wanna make sure that we don't wanna limit the number of grafts we're gonna do. We wanna do it one time if we can. And you know, with advanced hair loss, there's a possibility you had to repeat it. But the more you put in, the less chance you have to come back. So, okay, well, you have anything to say before we go in the operating room?
See you in a year.
Yeah, that's great. And you know, Roman, I want to make him into my patient's name. Alejandro, no, not my patient, but I want to make him look like Alejandro Fernandez, famous singer, right? Son of Vicente Fernandez. So
Correct.
he looks excellent. So I'm excited for you. Okay?
Okay.
Take care. Please follow up and wait for us. For more information, you can go to my website at www.mhtaclinic.com or call 1-866-999-6482 or 408-356-8600.